Hi guys, welcome back to another video. As you can tell by the title of the video, I'll explain a typical day shift. Let's get with it. So I've got my notebook here and I've written down a few things just so I don't forget. And the shift will start with a handover. The handover will be about 30 minutes. This handover is given to you by the nurse who worked the previous shift. As soon as handover is finished, the nurses working on the shift will allocate themselves who will be the nurse in charge. One of the nurses will go off to do the morning medication round. This medication round can take from an hour to 2 hours. It really depends on the kind of patient that you are looking after that shift. For example, a patient who may have an NG tube. So an NG tube is a tube that goes all the way down to your stomach from your nose, and they might be nil by mouth. So you'll need to prepare the medication in a little pot, break it down, like crush them, mix it up with some water and put it through the tube. This is a little bit of a time-consuming process, and so this can build up the time it takes for you to complete your whole drug round. While that nurse is doing the medication round, the other nurse and the healthcare assistants will assist patients with breakfast, changing bed sheets, bed linens, helping the patients with any washing that they need to do. Also go around each bedside, cleaning up their area, and also updating the charts. Charts can include rounding charts, food charts, fluid charts, and also throughout the whole shift we make sure that we assess all of the patient's skin as necessary. I mean as necessary, I mean, for example, a patient who is about my age, completely mobile and independent, their skin usually does not need to be assessed because it will be intact. Whereas if we are looking after an 80-year-old lady, then we will have to check her skin, and this should be done regularly because they are most prone to skin damage. Medical doctors usually arrive between 8:30 to 9, and then they will soon begin their ward round with the consultants. Usually the senior nurse or the nurse in charge will update the board before the doctors arrive, and then once the doctors have arrived, they'll just quickly go through the board with them. So the board is the list of all the patients that we are looking after. It explains the tasks that need to be done for each patient, what treatments they are waiting and are having currently, and if they need any referrals for example to a physiotherapist or an occupational therapist or a dietitian. Other tasks for the nurse is to update the bed manager of any potential discharges, and also the bed manager will inform you of any patients that can come up once a discharge from your side has been done. Another task is to check the CD cupboard. This CD cupboard will be locked away in another room. This consists of all the high-class medications such as morphine, fentanyl patches, etc. This check has to be done by 2 nurses, TTOs or TTAs. This stands for to take away or to take out. It's basically a piece of paper explaining the summary of the patient's care in hospital since admission, the medications they need to take and how often they need to take it, and if they need any follow-up in the future. These TTOs need to be sent down to pharmacy. Usually there is a pharmacist on the ward and we will be able to just hand it over to them. The pharmacist will go through the TTO, going through all the medications, making sure that it is the correct dosage and if the patient really requires it. They'll consult with the doctors as well, and usually the medications will all arrive later that day. Right, going into the main task is observations. Observations is measuring the vital signs, which is temperature, blood pressure, respiratory rate, oxygen saturation, heart rate, assessing their pain level. This is a score from 1 to 3, 1 being the lowest and 3 being the highest. Taking all of those assessments, there will be a score at the end, and depending on what score they get, that will decide how often their observation should be taken throughout the day. Lunch will be around 12 to 1. The nursing and healthcare staff will go around to the patients and see if they need any support in eating. At the end of lunch and to about 2 p.m. in the afternoon is the second drug round for the shift. Usually at lunchtime there isn't that many medication to be given. Sometimes what is to be administered are a lot of IV bags. IV bags are intravenous bags. So for example, if someone is prescribed 500 ml of fluid, then we need to prepare all of that and make sure the patient has a cannula. So it can be time consuming in that sense. So after we finish our medication at lunchtime, we can finally sit down and write some nursing notes. We write these notes in the medical folder so that the doctors and other multidisciplinary teams can see. Usually our nursing note is following the ADL, that's activities of daily living. This can include communication, eating and drinking, continence level, integrity of their skin, and many more. For example, you could say patient A has been nil by mouth this morning because they were to be going for a procedure. The patient has come back from the procedure and is now eating as usual. Eating and drinking fine, normal diet and fluids. If we have time, we usually like to have another board round with the doctors. This is to get an update from them since they will have finished their rounds with the consultant and seeing all the patients. It's a quicker way of obtaining the tasks that we need to do for each patient instead of reading through all the medical notes. Speaking of tasks, in the afternoon, this is when we usually go through all the things that needs to be done for each patient as advised by the medical team. As well as working alongside doctors, there will be other specialists in the ward. For example, the physiotherapist, occupational therapist, a dietitian, the pharmacist. Dinner time is around 5 p.m. shortly after the medication round is done. Like the morning medication, in this drug round there is a lot of medication to go through, including a lot of subcutaneous injections, and this is usually called heparin. Heparin is an anticoagulant medication and it's basically to stop blood from clotting. When patients are in the hospital, they usually are less mobile than they would be when they're at home. This increases their chance of blood to be clot, and for example, if the blood has been clot in the leg, it can go up to the lungs and that can be very severe. From 7 to 7:30 p.m, this is when you would prep your handover. Also go through all the things that you should have done and see if you have any outstanding things. For example, any observations that are due again. Make sure that your charts are all up to date, and if there has been anything new for any of the patients, you update it in the medical notes. So we have come to the end of the shift. Other things that I missed out in my timeline was discharges and admissions. As explained earlier, discharges involve a TTO that needs to be given to the patient and also awaiting their medications from the pharmacy if they need any. And then they can safely go home once the cannula's been removed and the patient's been explained on how to take the medications and if they have any follow-ups. When you have a discharge, it means you get an admission as well. Admissions are a long process because there are a lot of care plans that we have to go through as nurses. Now, the shift that I've just explained is a very great shift, but unfortunately that's not always the case. We may have, for example, patients who need resuscitation. That can take time and that can build on more tasks that we need to do in the day. Also, patients who have falls involves us updating their care plans, getting investigations done, for example a CT head, to make sure there's no bleeding. So guys, I think I've covered most of the basics of a typical day shift for a nurse in the UK. If you guys have any questions, let me know in the comment section below. If you haven't already, subscribe to my channel. If you like this video, give it a thumbs up. And again, I'm a registered nurse in the UK, qualified in 2019. Take care and see you guys in the next video. Bye!